what to avoid. Soft calming tone throughout, approximately 1,100 words. Hello and welcome. Take a moment to breathe deeply and settle into this peaceful space. Today we're going to explore ingredient interactions in skincare, understanding which ingredients work beautifully together and which combinations should be avoided. Skincare has become wonderfully sophisticated, with powerful ingredients available to help us address various concerns. But with this sophistication comes complexity. Not all ingredients play well together. Some combinations can irritate your skin, reduce effectiveness, or even cause harm. Let's navigate this together with calm, informed awareness. First, let's understand why ingredient interactions matter. Your skin has a delicate balance. Its pH, barrier function, and cellular processes all work within specific parameters. When you apply multiple active ingredients, they interact, sometimes synergistically, enhancing each other's benefits, but sometimes antagonistically, reducing effectiveness or causing problems. Think of your skincare routine as a recipe. Just as some flavors complement each other while others clash, skincare ingredients have compatibility profiles. Understanding these helps you create a routine that works harmoniously rather than creating conflict on your skin. Let's start with one of the most important principles: pH compatibility. Different ingredients work best at different pH levels. Your skin's natural pH is slightly acidic, around 4.5 to 5.5. Some ingredients like vitamin C and AHAs work best at lower pH, more acidic. Others, like niacinamide, work best at neutral to slightly acidic pH. When you layer ingredients that require very different pH levels, they can interfere with each other's effectiveness. Your skin can adjust pH over time, but immediately after application, pH matters. Now let's explore specific ingredient combinations, starting with what works well together. Vitamin C plus vitamin 𝒆𝒐𝒊𝒏𝒈 acid. This is one of the most well-researched synergistic combinations in skincare. Vitamin C and vitamin E work together as antioxidants, each stabilizing and enhancing the other's effectiveness. Ferulic acid further stabilizes both vitamins and boosts their antioxidant power. The famous SkinCeuticals CE ferulic serum is based on this research, but you can find this combination in various products now. These three ingredients together provide more antioxidant protection than any would alone. Niacinamide peptides. Niacinamide and peptides are both gentle, well-tolerated ingredients that work beautifully together. Niacinamide helps strengthen the skin barrier and reduce inflammation, creating an ideal environment for peptides to work on collagen synthesis and skin repair. These ingredients don't interfere with each other and can be layered in the same routine without issues. Retinoids plus hydrating ingredients. Retinoids can be drying and irritating, especially when you're first starting. Pairing them with deeply hydrating ingredients like hyaluronic acid, glycerin, or ceramides helps buffer potential irritation while supporting the skin's barrier during retinoid adaptation. This isn't a chemical interaction. It's a practical pairing that makes retinoid use more comfortable and sustainable. 𝒆𝒐𝒗𝒊𝒏, hyaluronic acid. Eyes can be drying due to their exfoliating action. Following with hyaluronic acid helps replenish moisture and soothe any potential irritation from the exfoliation. This is a gentle, practical combination. Now let's discuss combinations that should be avoided or approached with caution. Vitamin C plus niacinamide. Myth versus reality. For years, people believed vitamin C and niacinamide couldn't be used together because they would chemically react and reduce effectiveness or cause irritation. The science behind this concern was actually based on old studies using very high concentrations and heat, conditions not present in normal skincare use. Modern research shows that vitamin C and niacinamide can actually be used together safely at the concentrations found in skincare products. Many people use them together without problems. However, and this is important, some people do experience flushing or redness when using these ingredients together. This isn't a dangerous reaction, just potentially irritating for some skin types. If you want to use both, you can try them together and see how your skin responds, or you can play it safe by using one in the morning and one at night. Both approaches work fine. Retinoids plus BHAs. This combination requires caution. Both retinoids and chemical exfoliants, AHAs and BHAs, increase cell turnover and can be irritating, especially together. Using them simultaneously can lead to overexfoliation, redness, peeling, sensitivity, and barrier damage. If you want to use both in your routine, use them on alternate nights. Retinoid Monday, Wednesday, Friday, acids Tuesday, Thursday, Saturday. Use one in the morning and one at night, though retinoids should really be nighttime only. Use them together only if your skin is very resilient and well adapted to both, and even then, proceed cautiously. Retinoids. Benzoyl peroxide. These two ingredients can oxidize each other, reducing their effectiveness. If you're using both for acne treatment, apply them at different times. Benzoyl peroxide in the morning, retinoid at night. This prevents them from interfering with each other while still getting benefits from both. Vitamin C plus retinoids. Both vitamin C and retinoids are powerful actives that can be irritating. Using them together can sometimes cause excessive irritation, especially if you're new to either ingredient. Additionally, most vitamin C products work best at a low pH, around 3.5 or below, while retinoids work at a higher pH. When used together immediately, the pH difference can reduce effectiveness of one or both. The safest approach, use vitamin C in the morning. It provides excellent antioxidant protection during the day, and retinoid at night, when it won't be degraded by sun exposure. If you have very resilient skin and want to use both at night, wait 20 to 30 minutes between applications to allow pH to normalize. Multiple strong actives. Even if individual combinations are safe, using too many actives at once overwhelms your skin. For example, using vitamin C, retinoid, AHA, and niacinamide all in the same routine is likely too much for most skin, even though each individual pairing might be okay. Simplicity is often more effective than complexity. Choose a few key actives that address your main concerns and use them consistently, rather than trying to use everything at once. Let's talk about buffering and spacing, techniques that make tricky combinations safer. Buffering. Buffering means mixing a potentially irritating active with a moisturizer or applying moisturizer before or after the active. This dilutes the concentration slightly and provides a protective barrier, reducing irritation without completely eliminating effectiveness. For example, if retinoid is too harsh directly on skin, you can mix it with your moisturizer before applying. Apply moisturizer first, then retinoid, called the sandwich method. Apply retinoid, then immediately follow with moisturizer. This makes actives gentler and more tolerable, especially when starting or if you have sensitive skin. Spacing. Spacing means waiting time between applying different products. This allows skin pH to normalize between products with different pH requirements, each ingredient to penetrate and start working before adding the next. Reduced risk of ingredients interacting on the skin surface. Wait times don't need to be long. Even 5 to 10 minutes can make a difference, though 20 to 30 minutes is ideal for pH-dependent ingredients like vitamin C before applying pH-sensitive ingredients. Now let's discuss building a layered routine without conflicts. The general layering order. 1. Cleanser, pH around 5 to 5.5 ideally. 2. pH-dependent actives, vitamin C, AHAs. Wait 5 to 30 minutes if possible. 3. Water-based serums, hyaluronic acid, niacinamide. 4. Retinoids, if using at night, can wait 10 to 20 minutes before moisturizer if desired. 5. Moisturizer 6, face oil if using. 7. Sunscreen, morning only, always last step. Thinnest to thickest consistency generally works, with the exception that actives might come before hydrating serums, even if they're slightly thicker. Morning versus evening split. One of the easiest ways to avoid conflicts is splitting actives between morning and evening. Morning. Focus on protection, cleanse, vitamin C, hydrating serums, moisturizer, sunscreen. Evening. Focus on treatment and repair, cleanse, treatment actives, retinoid, OR acids, not both, same night, hydrating serums, moisturizer, face oil if desired. This natural division keeps potentially conflicting ingredients separate while providing all their benefits. Alternate night approach. For people using multiple treatment actives, alternating nights works beautifully. Monday, Wednesday, Friday, retinoid. Tuesday, Thursday, Saturday, AHA, BHA, Sunday. Rest night with just gentle hydrating products. This prevents overtreatment while still using multiple actives effectively. Let's address some common questions about ingredient interactions. Can I use everything if I just wait between steps? Waiting helps, but it doesn't solve all compatibility issues. If your skin shows signs of irritation, overwhelm, or barrier damage, even with proper spacing, you're using too much. Listen to your skin over any routine template. How do I know if ingredients are conflicting? Signs of problematic interactions include increased redness or irritation, stinging or burning on application, excessive dryness or flaking, breakouts that weren't there before, texture changes, rough, bumpy, or overly smooth, shiny. What if my favorite product contains conflicting ingredients together? If a product formulator has combined ingredients that theoretically conflict, they've likely adjusted pH, used stabilizers, or employed other formulation techniques to make them work together. A well-formulated product with conflicting ingredients is generally fine to use. As we come to the end of our exploration, remember that ingredient interactions matter, but they shouldn't paralyze you with fear or make skincare overly complicated. Start simple. Add one new active at a time and let your skin adjust before adding another. If something feels wrong, stinging, excessive irritation, or other concerning symptoms, simplify your routine. Your skin will tell you if something isn't working. Trust those signals. No ingredient or combination is worth compromising your skin's health and comfort. Take a deep breath in and release it slowly. You now understand the basics of ingredient compatibility and can build a routine that works harmoniously rather than creating conflict. Choose quality over quantity. Be patient with results. Listen to your skin's feedback, and remember that simpler routines are often more effective than complex ones. Thank you for this peaceful exploration of ingredient interactions. May your skincare routine bring you healthy, balanced skin without unnecessary complexity or stress. Be gentle with your skin, patient with the process, and trust yourself to know what works for you. Just seasonally, lighter in summer, richer in winter for sensitive skin. Texture matters less than gentle ingredients. Generally, simpler formulations, fewer emulsifiers and additives, work better. Some sensitive skin prefers minimal products, just oil plus balm. Others need full routines. Experiment to find what your skin tolerates. Texture shouldn't sting or irritate. If it does, the product isn't right, regardless of how appropriate the texture seems. For mature skin, richer textures typically feel more comfortable and nourishing. Skin's natural oil production decreases with age, so you may need more emollient products now than when younger. Don't force lightweight products if skin feels dry. It needs what it needs. Nighttime especially benefits from richer textures. Let's discuss layering multiple textures effectively. The general principle is thin to thick, water-based to oil-based. This ensures each product can penetrate properly. Lighter products aren't blocked by heavier ones. Your skin receives full benefits of each layer. A typical layering sequence: 1. Watery toner or essence. 2. Lightweight serum, water-based. 3. Heavier serum if using multiple 4. Emulsion or light cream, 5. Richer cream if needed, 6. Oil if desired, 7. Balm on very dry areas only. You don't need all these layers. Most people use 3 to 5 products total: cleanser, serum or 2, moisturizer, sunscreen, AM. This layering principle just helps when you do use multiple products. Let's address some common texture-related concerns. My skin feels greasy after products. This might mean textures are too heavy for your skin type or season. You're using too much product. Products aren't formulated well for your skin. You need more time to let products absorb before adding more layers. Try lighter textures, smaller amounts, or waiting between application steps. Products seem to sit on top of my skin. This often happens when you're layering incompatible textures, like water-based over oil-based. You're using too much product. Your skin barrier is compromised and can't absorb effectively. Products contain ingredients that create film, like heavy silicones. Adjust your routine order, amounts, or product choices. My skin feels dry even with rich products. This might indicate dehydration more than dryness, needing water-based hydration, not just oils, barrier damage preventing products from working effectively, need for multiple texture layers, serum plus cream plus oil, rather than one heavy product, need for occlusive products like balm to seal in moisture. Try layering hydration before oils or add an occlusive final step. As we close, remember that texture preference is deeply personal. What feels luxurious to one person might feel heavy to another. What absorbs quickly on some skin might sit on others. Experiment with different textures. Notice what your skin likes, what feels comfortable, what delivers results. Your preferences may change with seasons, age, or life circumstances, and that's perfectly normal. Trust your skin's feedback and your own preferences. The right texture is the one that makes you happy to use it, feels comfortable, and delivers the results you're seeking. Take a deep breath in and release it slowly. You now understand skincare textures and can choose products that suit your unique needs and preferences. Be gentle with your skin, patient with finding what works, and enjoy the sensory pleasure of textures that delight you. Thank you for exploring this topic together. May you find textures that bring your skin joy, comfort, and healthy balance. Trust yourself, honor your preferences, and remember that skincare should feel good, not just work well.
Ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely, and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ing/dL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dL, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation: irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why: medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1,000 to 4,000 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oil supplementation is safe for most people, though it can cause mild gastrointestinal upset and rare interactions with blood thinners. Plant-based omega-3, ALA from flax or chia, is less effective than fish-derived EPA/DHA. Probiotics as oral supplements have mixed evidence for acne. While probiotics support gut health and might support skin through gut-skin axis mechanisms, specific acne benefits aren't reliably demonstrated. Some people report acne improvement with specific probiotic strains, but individual variation is substantial. If interested in probiotics, quality products with documented effective strains are preferable to low-quality products, though quality doesn't guarantee benefit. N-acetylcysteine supports glutathione production and has anti-inflammatory and antioxidant effects. Some evidence suggests NAC might improve inflammatory acne. Typical dosing is 600 to 1,200 mg daily. NAC is generally well tolerated, though some people experience gastrointestinal upset. Spironolactone supplementation is sometimes discussed, but spironolactone is a pharmaceutical medication, not a supplement, requiring prescription. This isn't applicable for over-the-counter supplementation. Saw palmetto is a botanical supplement claimed to reduce DHT and support acne. Evidence is limited and mostly from prostate health studies rather than acne-specific research. Acne-specific benefits aren't well established. Red clover contains isoflavones with weak estrogenic effects, claimed to reduce androgen activity and improve acne. However, evidence is limited. Additionally, red clover might interact with hormonal medications. Spearmint tea supplementation has some evidence for hormonal acne reduction through weak antiandrogenic effects. Drinking 2 cups of spearmint tea daily for several months might improve hormonal acne modestly in some women. This is one of the few plant-based approaches with dedicated acne research, though evidence is still limited. Licorice extract is promoted for anti-inflammatory effects. Topical licorice has some evidence for skin benefit, though oral licorice supplementation for acne lacks strong evidence. Additionally, chronic
Welcome, and take a moment to breathe deeply. Feel yourself becoming calm and centered. Today we're going to talk about managing oily skin calmly, without frustration, without harsh treatments, with understanding and gentle effectiveness. If you have oily skin, you might feel like you're constantly battling shine, dealing with makeup that slides off, or worrying about your appearance throughout the day. But here's an important reframe. Oily skin is not bad skin. It's simply skin that produces more sebum than other types. And oily skin comes with advantages. It typically ages more slowly, develops fewer fine lines and maintains moisture better than dry skin. The key to managing oily skin is working with it, not against it. Harsh stripping treatments that remove all oil actually trigger your skin to produce even more oil in compensation. A calm, gentle approach that supports your skin's balance works far better. Let's understand why skin becomes oily. Sebaceous glands in your skin produce sebum, an oil that protects and moisturizes. Some people's glands simply produce more than others due to genetics. Hormones significantly influence oil production. Androgens increase sebum production, which is why oily skin often worsens during puberty, menstruation, pregnancy, or times of hormonal change. Stress increases cortisol, which can trigger more oil production. Dehydrated skin may overproduce oil trying to compensate for lack of moisture. Harsh cleansing strips oil, triggering your skin to produce even more. Understanding these factors helps you address them thoughtfully. The foundation of managing oily skin calmly is proper cleansing. Use a gentle gel or foam cleanser formulated for oily skin. Look for ingredients like salicylic acid, which helps regulate oil and keep pores clear. A concentration of 0.5 to 2% is effective without being harsh. Cleanse once daily in the evening. This might seem insufficient if you're used to cleansing multiple times per day, but over-cleansing backfires. When you strip away all oil, your skin panics and produces more. One thorough evening cleanse removes the day's accumulation without triggering overproduction. In the morning, many oily skin types can simply rinse with lukewarm water. You haven't accumulated much oil overnight, just a light protective layer that's actually beneficial. If you feel you must cleanse in the morning, use your cleanser very briefly, or just apply it to your T-zone. Use lukewarm water, never hot. Hot water strips oil aggressively, damaging your barrier and triggering more oil production. Massage your cleanser gently for about 60 seconds, then rinse thoroughly. After cleansing, resist the urge to skip moisturizer. This is crucial. Oily skin needs hydration. Oil and hydration are different. Your skin produces oil, but it still needs water. When properly hydrated, your skin actually produces less oil over time. Choose a lightweight, oil-free, non-comedogenic moisturizer. Gel or gel cream formulas work beautifully for oily skin. Look for ingredients like hyaluronic acid for hydration, niacinamide for oil regulation, and glycerin for moisture retention. Apply moisturizer to slightly damp skin morning and evening. This seals in water and supports your skin's barrier function. Within a few weeks of consistent moisturizing, many people notice their oil production decreasing. Sun protection is essential and doesn't have to make you oilier. Choose lightweight, mattifying sunscreens formulated for oily skin. Gel sunscreens absorb without residue. Many mineral sunscreens with zinc oxide have a slight mattifying effect. Some chemical sunscreens are extremely lightweight and invisible on the skin. Apply sunscreen every morning after moisturizer. The right formulation won't increase shine and will protect your skin from damage and premature aging. For oil control throughout the day, use blotting papers rather than washing your face repeatedly. Blotting papers absorb excess surface oil without stripping your skin or triggering more production. Keep them in your bag or desk for quick touch-ups. Carry a lightweight, oil-free moisturizer for midday if your skin feels dehydrated. Sometimes what feels like excessive oil is actually your skin compensating for dehydration. Setting powder or mattifying powder can reduce shine if you wear makeup. Look for translucent, non-comedogenic formulas. Apply lightly to oily areas, T-zone typically, using a fluffy brush. Incorporate oil-regulating ingredients into your routine. Niacinamide at 5% concentration helps regulate sebum production over time. It's gentle enough for twice daily use and provides multiple benefits: oil control, barrier support, and reduced inflammation. Clay masks once or twice weekly help absorb excess oil. Use masks with kaolin or bentonite clay on your T-zone or entire face. Leave on for 10 to 15 minutes. Rinse with lukewarm water and follow with moisturizer. Salicylic acid treatments 2 to 4 times weekly help keep pores clear and may help regulate oil. Use a leave-on treatment with 0.5 to 2% salicylic acid after cleansing, before moisturizer. Retinoids can help regulate oil production and improve overall skin texture. Start with over-the-counter adapalene or ask a dermatologist about prescription options. Use them slowly at first, 2-3 times weekly, and always with adequate moisturization. Now let's discuss lifestyle factors that affect oily skin. Manage stress, which directly increases oil production through hormonal pathways. Regular exercise, meditation, adequate sleep, and stress reduction practices all help regulate your skin's oil output. Stay hydrated internally. When your body is well hydrated, your skin can better regulate its moisture and oil balance. Drink water consistently throughout the day. Evaluate your diet. Some people find that dairy or high glycemic foods increase their oiliness. If you suspect a connection, try eliminating these foods for a month and observe whether your skin improves. Get adequate sleep. During sleep, your skin repairs and rebalances itself. Chronic sleep deprivation can disrupt hormones and increase oiliness. Don't touch your face unnecessarily. Your hands transfer oil and bacteria, potentially making oiliness and breakouts worse. Keep everything that touches your face clean: pillowcases, phone, makeup brushes. These can reintroduce oil and bacteria to your skin. Be patient with your skin's adjustment period. If you're transitioning from harsh, stripping products to gentle care, your skin needs time to recalibrate its oil production. This typically takes 2 to 4 weeks. During this time, your skin might seem oilier than usual. Stay the course. It will balance. Let's address what not to do for oily skin. Don't use harsh, stripping cleansers or alcohol-based toners. These feel satisfying in the moment, that squeaky clean sensation, but they trigger rebound oil production. Don't over-cleanse or over-exfoliate. More is not better. Excessive cleansing and exfoliation damage your barrier and increase oiliness. Don't skip moisturizer and sunscreen thinking they'll make you oilier. The right formulations won't increase oil and are essential for skin health. Don't expect instant results. Oil regulation takes weeks to months of consistent, gentle care. Accept that some level of oil is natural and healthy. You're not aiming for completely matte, oil-free skin all day. That's neither realistic nor necessary. You're aiming for balanced skin that doesn't produce excess oil. Consider professional help if needed. If your oily skin is severe, causing significant acne, or not responding to home care, a dermatologist can offer prescription treatments, stronger retinoids, spironolactone for hormonal oil reduction, or other options. Remember the advantages of oily skin. You'll likely age more slowly, develop fewer wrinkles, and maintain better moisture than people with dry skin. Your natural oils protect your skin. This is a feature, even if it sometimes feels like a burden. As we close, embrace this calming truth. Oily skin can be balanced through gentle, consistent care. Stripping and fighting your skin makes things worse. Supporting and working with your skin's natural processes brings lasting balance. May your skin find its natural balance. May you manage your oily skin with calm and patience. May you appreciate the benefits your skin type provides. Thank you for this time together. Manage your oily skin calmly, gently, and effectively.
Other treatments, fillers, microneedling, often provides better results than subcision alone. Microneedling creates controlled microinjuries triggering collagen production and remodeling. The skin's healing response generates new collagen, improving scar appearance. Multiple treatments, typically 3 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Microneedling works for all scar types but is particularly effective for rolling and moderate boxcar scars. Post-treatment appearance includes temporary redness and microcrusting. Recovery takes 3 to 5 days for most people. Microneedling is relatively affordable compared to laser treatments and is increasingly popular for scar treatment. Radiofrequency microneedling combines microneedling with radiofrequency energy for enhanced collagen stimulation. This provides better results than standard microneedling but with more significant post-treatment appearance changes and potential side effects. Laser resurfacing removes thin layers of skin, smoothing scars and promoting collagen remodeling. Fractional laser resurfacing treats portions of skin, leaving untreated bridges for faster healing and less downtime than full resurfacing. CO2 fractional lasers are highly effective for acne scars. Multiple treatments, typically 4 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Post-treatment appearance includes significant redness lasting several weeks and potential for whitening, hypopigmentation. Cost is substantial, $500 to $1,500 per treatment, but results are often dramatic. 𝒔𝒐𝒏 fractional lasers are slightly less aggressive than CO2 lasers, with somewhat less downtime and slightly less dramatic results. For those seeking good results with less recovery time, 𝒔𝒐𝒏 is a reasonable option. Chemical peels remove skin layers through acid application. Superficial peels with glycolic or salicylic acid remove only the superficial layer and provide minimal scar improvement. Medium-depth peels with TCA, trichloroacetic acid, penetrate deeper, removing epidermis and superficial dermis, providing better scar improvement. Medium peels require 5 to 7 days of peeling and recovery. Deep peels with phenol or high-concentration TCA penetrate most deeply but require significant recovery time and carry higher complication risks. Deep peels are rarely used for acne scars specifically, being reserved for severe aging or other conditions. Dermal fillers inject material beneath scars to elevate depressed scars temporarily. Different fillers last different durations. Hyaluronic acid fillers typically last 6 to 12 months, while longer-lasting fillers, calcium hydroxylapatite, polyl-lactic acid, last 12 to 24 months. Filler results are immediate, making this attractive for short-term improvement. However, repeated treatments are necessary to maintain results. Fillers work particularly well for 𝒆𝒐𝒃 and boxcar scars. Platelet-rich plasma (PRP) therapy uses concentrated growth factors from your own blood to stimulate collagen production and healing. PRP is injected into scarred areas, promoting new collagen formation. Multiple treatments are typically needed. While PRP is popular, evidence for its efficacy in acne scar treatment is mixed, and it's more commonly used as a supplement to other treatments rather than as monotherapy. Combination approaches yield best results for acne scarring. A typical combination might include subcision for tethered scars, followed by microneedling for collagen stimulation, combined with fractional laser for surface smoothing and additional collagen remodeling. This multimodal approach addresses different aspects of scarring simultaneously. Treatment planning requires professional expertise. Severe, extensive scarring warrants referral to specialized dermatologists experienced in scar revision. Your dermatologist can assess your specific scars and recommend appropriate treatments. Realistic expectations are essential. Most scars improve significantly, 50 to 75%, but are rarely completely eliminated. Severe, deep scarring might only achieve 30 to 40% improvement even with aggressive treatment. However, significant improvement is usually achievable and worthwhile. Timeline for scar improvement is measured in months and years, not weeks. After a laser treatment providing immediate dramatic improvement, additional improvement occurs over 3 to 6 months as collagen remodels. Multiple sequential treatments provide cumulative improvement over 6 to 12 months or longer. Cost is a consideration. Professional scar treatments are expensive, laser treatments $500 to $1,500 per session, multiple sessions required. Microneedling is more affordable at $200 to $400 per session. Fillers vary based on amount needed. Insurance typically doesn't cover cosmetic scar treatment. Discussing cost with your dermatologist and potentially planning treatment over time is reasonable. Home care between professional treatments supports improvement. Proper sun protection prevents hyperpigmentation that makes scars more noticeable. Hydration and appropriate skincare supports skin healing. Some evidence suggests that certain topical ingredients like retinoids and vitamin C might provide modest scar improvement through collagen support, though these effects are minor compared to professional treatments. Scar appearance often improves naturally over years. Post-inflammatory changes gradually fade. Scars that seem severe initially might improve significantly over 12 to 24 months even without treatment, though active treatment accelerates improvement. Guide 32. Environmental and occupational factors influencing acne. Acne development isn't purely internal. Environmental and occupational factors significantly contribute to breakouts. Understanding these external factors allows you to modify your environment and workplace practices to support clearer skin. Heat and humidity increase sebum production and promote bacterial growth, worsening acne. People living in tropical climates or hot, humid environments experience more significant acne than those in cool, dry climates. While you can't change your climate, understanding that heat worsens acne helps you implement compensatory strategies. Increase air conditioning use if possible. Use a humidifier in dry climates to prevent the skin barrier compromise that can paradoxically worsen acne. Keep skin cleaner during hot, humid times when sebum production is highest. Sweating creates moisture that promotes bacterial growth in pores. Athletes or people with active occupations experience acne worsening related to sweat. The solution is simple: shower immediately after sweating, change into clean clothes, and avoid touching your face during exercise. Exercise itself is beneficial for stress reduction and hormonal balance, so don't avoid it, just manage post-exercise hygiene properly. Friction from tight clothing, athletic equipment, or repetitive face touching, occupational hand-face contact, can trigger acne. Friction acne appears where contact occurs, under helmet straps, where backpack straps compress skin, on the jawline from phone contact. Wearing loose, breathable clothing, ensuring equipment is clean, and avoiding touching your face helps prevent friction acne. Occupational chemical exposure contributes to acne in certain professions. Workers in automotive, petrochemical, or metalworking industries' exposure to mineral oils, cutting fluids, and other chemicals experience acne, occupational acne. Wearing appropriate protective equipment, washing thoroughly after work, and changing out of contaminated clothing help prevent this exposure-related acne. Chlorine exposure worsens acne, particularly in swimmers. Chlorine is drying and irritating to acne-prone skin. Swimmers should rinse immediately after swimming to remove chlorine, wash hair to prevent chlorine transfer to facial skin.
Hello, and welcome back to this calm space. Take a gentle breath with me. Breathe in slowly, deeply, and release softly, letting everything settle. Today we're going to talk about something many people struggle with in the modern skincare world: how to avoid overwhelming your skin with too many products. Walk through any beauty store or scroll through social media, and you'll encounter an endless parade of skincare products. 10-step routines, layering multiple serums, using different actives for different concerns, morning routines, evening routines, weekly treatments. The message is clear: more is better. But here's a truth the beauty industry doesn't want you to know: more is often worse. Your skin is incredibly intelligent. It has built-in mechanisms to regulate itself, repair damage, maintain moisture, and protect against threats. When you bombard it with too many products, you interfere with these natural processes. Instead of helping, you create confusion, irritation, and often more problems than you started with. Think about it this way. Imagine you're trying to have a conversation, but 10 people are all talking to you at once, all giving different instructions. You can't process any of it effectively. Your skin experiences something similar when you apply layer upon layer of different products with different active ingredients. Each product is sending signals to your skin cells, and too many signals at once create chaos, not harmony. Let's talk about what happens when you use too many products. First, there's the physical burden. Each product sits on top of the one before it. By the time you've applied 6 or 7 layers, you've created a thick film on your skin's surface. This can prevent your skin from breathing properly, clog pores, and create a breeding ground for bacteria. Your skin starts to feel congested, heavy, uncomfortable. Then there's the chemical complexity. Different products contain different active ingredients, and not all of them play well together. Some combinations can be irritating or even neutralize each other's effectiveness. For example, using retinol and vitamin C at the same time can be irritating for some people. Layering too many acids can damage your skin barrier. Using peptides with certain acids can reduce their effectiveness. You might be using perfectly good products that work against each other, rather than for you. Overwhelming your skin often leads to sensitization. When you expose your skin to too many ingredients, especially active ones, you increase the risk that something will trigger irritation or an allergic reaction. Even gentle ingredients can become problematic when combined with many others. Your skin barrier becomes compromised, leaving you with redness, burning, stinging, and reactive skin that seems to tolerate nothing. There's also the issue of not knowing what's actually working. If you introduce 5 new products at once and your skin improves, which one helped? If your skin gets worse, which one caused the problem? Using too many products simultaneously makes it impossible to understand your skin's actual needs and responses. You're flying blind. And let's be honest about the practical side. Using many products is expensive, time-consuming, and often unsustainable. Complicated routines that take 30 minutes twice a day are hard to maintain long-term. When life gets busy or you're tired, that elaborate routine becomes a burden rather than self-care. Consistency matters more than complexity, and simpler routines are easier to maintain consistently. So how do you know if you're using too many products? Listen to your skin. If it feels congested, greasy, or like there's always a film on its surface, you're probably using too much. If you're experiencing more sensitivity, redness, or breakouts than usual, product overload might be the culprit. If your skin looks dull despite using many supposedly brightening products, the layers might be preventing your skin from functioning properly. Here's another sign. If you can't remember all the products you're using or why you're using them, you're probably using too many. Your routine should be intentional, not just accumulated habits. Each product should have a clear purpose that you can articulate. Let's talk about what your skin actually needs. At its core, a basic routine requires only 3 things: cleansing, moisturizing, and sun protection. That's it. These 3 steps address the fundamental needs of all skin. Everything else, serums, essences, masks, treatments, is optional. They can be beneficial when chosen carefully for specific concerns, but they're not necessary for healthy skin. Think about building your routine, like creating a capsule wardrobe. You don't need 50 items that sort of work together. You need a few key pieces that work perfectly for your needs and complement each other beautifully. The same principle applies to skincare. A small collection of products you love and that serve clear purposes will always outperform a cluttered shelf of products you use inconsistently. Here's a healthy approach. Start with the basics and add only when necessary. Begin with a gentle cleanser, a good moisturizer, and sunscreen. Use these consistently for at least a month. Get to know your skin without interference from multiple actives. Notice how it feels, how it looks, how it responds to this simple foundation. If your skin is happy and healthy with just the basics, congratulations, you're done. There's no rule that says you must use serums or treatments. Healthy skin maintained with simple, consistent care is the goal, not using as many products as possible. If you have specific concerns you want to address, acne, dark spots, fine lines. Add one targeted treatment at a time. Choose the concern that bothers you most and introduce one product to address it. Use it consistently for at least 4 weeks before evaluating its effectiveness. If it works and your skin tolerates it well, great. If it doesn't work or causes problems, remove it before trying something else. This methodical approach takes patience, but it builds genuine understanding of your skin. You learn what works and what doesn't. You avoid the confusion and potential damage of trying too many things at once. And you save money by not accumulating products you don't need or that don't work for you. Let's talk about specific situations where people often use too many products. One common trap is the more actives is better mindset. Someone wants to address aging, so they use a retinol serum, a vitamin C serum, a peptide serum, an AHA exfoliant, and a niacinamide treatment, all at once. But your skin can only absorb and process so much. This combination is more likely to cause irritation than miraculous results. A better approach: choose 1 or 2 actives that address your main concern. Use them consistently. Let them work. Patience with a simple, targeted approach will give you better results than impatience with a complicated one. Another trap is trying to address every possible concern simultaneously. You want anti-aging and pore refining and brightening and acne fighting all at once. So you layer product after product, each targeting a different issue. But remember, many concerns actually stem from the same root cause. Healthy, well-hydrated skin with a strong barrier naturally looks more youthful, has less noticeable pores, appears brighter, and experiences fewer breakouts. Sometimes addressing the foundation solves multiple concerns at once. Social media and beauty influencers often promote extensive routines with many products. Remember, hello, and welcome to this gentle space of learning. Let's begin with a calming breath. Breathe in slowly and peacefully, and breathe out, releasing any tension. Today we're going to talk about something that affects many people but often goes unrecognized: the problem of over-cleansing and how to find a gentler, healthier approach to cleaning your skin. Over-cleansing is one of the most common skincare mistakes, and it's usually done with the best intentions. You want clean, clear skin, so you wash thoroughly and frequently. It makes intuitive sense. If your skin has problems, wash more, wash harder, wash with stronger products. But this logic, while understandable, actually creates more problems than it solves. Your skin is not a dirty surface that needs aggressive cleaning. It's a living ecosystem with its own protective mechanisms. When you cleanse too frequently, too harshly, or with products that are too strong, you strip away not just dirt and excess oil, but also the beneficial lipids, natural moisturizing factors, and protective elements your skin needs to function properly. Let's understand what happens when you over-cleanse. The most immediate effect is disruption of your skin barrier. Remember, your barrier is made of skin cells held together by lipids, like bricks and mortar. Harsh or excessive cleansing removes these protective lipids, creating gaps in your barrier. Water escapes through these gaps, leaving your skin dehydrated. Irritants enter through the same gaps, causing sensitivity and inflammation. Your skin's pH balance is also disrupted by over-cleansing. Healthy skin has a slightly acidic pH, around 4.5 to 5.5. This acidic environment supports your skin's beneficial bacteria and helps protect against harmful microorganisms. Harsh cleansers, especially those with high pH, disrupt this balance. It takes hours for your skin to restore its optimal pH after cleansing with a high pH product. And if you're cleansing multiple times a day, your skin never fully recovers. Over-cleansing can paradoxically make oily skin produce even more oil. When you strip away all your skin's natural oils, your skin panics and responds by producing even more sebum to compensate. This creates a vicious cycle. You cleanse aggressively because your skin is oily, which makes your skin produce more oil, which makes you cleanse even more aggressively. The solution isn't more cleansing. It's gentler cleansing that allows your skin to find its natural balance. For those with acne-prone skin, over-cleansing can actually worsen breakouts. Yes, you read that correctly. While cleansing is important for removing excess oil and bacteria, too much cleansing irritates your skin, compromises your barrier, and can trigger more inflammation and breakouts. Acne needs consistent, gentle cleansing, not aggressive over-cleansing. How do you know if you're over-cleansing? There are clear signs. If your skin feels tight, dry, or uncomfortable after cleansing, that's over-cleansing. That squeaky clean sensation many people seek is actually your barrier being stripped. Healthy cleansing should leave your skin feeling soft and comfortable, not tight and stripped. If your skin is becoming increasingly sensitive, reacting to products that never bothered you before, experiencing redness or stinging easily, over-cleansing might be compromising your barrier and making your skin more reactive. If you're experiencing more breakouts despite frequent cleansing, the cleansing itself might be the problem. If your skin looks dull, rough, or flaky despite moisturizing, over-cleansing could be constantly damaging your barrier faster than it can repair. If you're using blotting papers constantly throughout the day because of oil production, or if your makeup slides off within hours, your skin might be overcompensating for excessive cleansing by producing extra oil. So how do you stop over-cleansing? Let's explore a gentler approach that actually works better for your skin. First, reduce the frequency of cleansing. For most people, thorough cleansing once per day in the evening is sufficient. At night, you're removing the day's accumulation: makeup, sunscreen, oil, sweat, environmental pollutants. This cleanse needs to be thorough because there's actually something to remove. In the morning, your skin hasn't accumulated much overnight, just some natural oils and perhaps a bit of sweat. Many people find that a simple splash of lukewarm water is enough for the morning, no cleanser needed. Just rinse your face gently with water, pat dry, and continue with your morning routine. If your skin feels like it needs a light cleanse in the morning, perhaps it's quite oily, use an extremely gentle cleanser, lighter than what you use at night. Or use micellar water on a cotton pad to lightly refresh without stripping. But resist the urge to do a full, thorough cleanse twice daily unless your skin genuinely needs it, which most skin types don't. Second, choose gentler cleansing products. If your cleanser foams heavily, contains sulfates like sodium lauryl sulfate, or has a high pH, it's likely too harsh for daily use. Look for cream cleansers, milk cleansers, or gentle, low-foaming gel cleansers. These clean effectively without stripping your barrier. Read ingredient lists. Avoid harsh surfactants. Avoid high concentrations of alcohol. Avoid unnecessary fragrance. Choose cleansers described as gentle, hydrating, or barrier supporting. Your cleanser should have a pH close to your skin's natural pH. around 5 to 5.5. Some brands list the pH. If yours doesn't, gentle formulas are usually in the right range. If you wear heavy makeup or water-resistant sunscreen, consider the double cleanse method, but gently. Use an oil-based cleanser or cleansing balm first to dissolve the makeup and sunscreen. Massage it on dry skin, emulsify with water, rinse thoroughly. Then follow with your regular gentle cleanser to actually clean your skin. This two-step process cleans thoroughly without aggressive scrubbing or harsh products. Third, improve your cleansing technique. Use lukewarm water, never hot. Hot water strips lipids and irritates skin. Wet your face thoroughly before applying cleanser. Take a small amount of cleanser, often a dime-size amount is plenty, and apply it with gentle circular motions using your fingertips. You're not scrubbing, you're massaging. There should be no friction, no pressure, no aggressive rubbing. Spend about 30 to 60 seconds cleansing. That's enough time to be thorough without overdoing it. Rinse thoroughly, at least 10 to 15 splashes of lukewarm water to ensure no cleanser residue remains. Then pat your face dry with a clean, soft towel. Pat, don't rub. Rubbing creates friction and irritation. Fourth, eliminate unnecessary cleansing tools unless you're sure they're helping. Cleansing brushes, scrub brushes, and similar devices can be too harsh when used daily. If you use them at all, use them sparingly, once or twice a week at most, on the gentlest setting with minimal pressure. For most people, fingertips are the best cleansing tool, naturally gentle, precise, and controlled. Fifth, stop using harsh exfoliating products as part of your daily cleanse. Exfoliation is a separate step that should be done occasionally, once or twice weekly, not every time you wash your face. If your cleanser contains exfoliating beads, scrub particles, or strong acids, you're over-exfoliating every time you cleanse. Choose a welcome and breathe with me. In through your nose, out through your mouth. Let your body soften. Today we're exploring a powerful connection, the link between your stress levels and your skin's health. Your skin and your mind are intimately connected. They develop from the same embryonic tissue, and throughout your life, they remain in constant communication. What affects your emotional state affects your skin, and what affects your skin can influence your emotional well-being. This connection is so significant that there's an entire field of study dedicated to it. Psychodermatology. Stress isn't just in your head, it's in your entire body, including your skin. When you experience stress, your body responds with a cascade of physiological changes designed to help you face challenges. This stress response served our ancestors well when threats were immediate and physical. But in modern life, where stressors are often chronic and psychological, this same response can wreak havoc on your skin. Let's understand what happens in your body when you're stressed and how this affects your skin. When you perceive stress, your hypothalamus, a tiny command center in your brain, sets off an alarm system in your body. This triggers the release of stress hormones, primarily cortisol and adrenaline. These hormones prepare your body for fight or flight by increasing heart rate, sharpening focus, and redirecting resources toward immediate survival. For your skin, this means several things happen. Your body produces more oil. Cortisol stimulates your sebaceous glands to produce more sebum. If you're prone to acne, this excess oil can clog pores and trigger breakouts. Many people notice their acne worsens during stressful periods, exams, work deadlines, relationship troubles. This isn't coincidental. Your skin becomes more sensitive. Stress compromises your skin's barrier function, the protective outer layer that keeps irritants out and moisture in. When this barrier is weakened, your skin becomes more reactive, more prone to irritation, redness, and sensitivity. Products you normally tolerate might suddenly cause stinging or redness. Inflammation increases throughout your body, including in your skin. Chronic stress keeps your body in a state of low-level inflammation, which can worsen conditions like acne, rosacea, eczema, and psoriasis. If you have any inflammatory skin condition, stress often makes it flare. Your skin's healing slows down. Studies show that wounds heal more slowly in people experiencing chronic stress. This applies to acne lesions, minor cuts, and any other skin damage. Your stressed body is less efficient at repair and regeneration. You might develop stress-related behaviors that harm your skin. Picking at your skin, neglecting your skincare routine, eating poorly, sleeping less. These are common stress responses that directly impact skin health. Blood flow patterns change. In acute stress, blood flow is redirected away from your skin toward vital organs and muscles. Over time, this can leave your skin looking dull and tired. Conversely, in some people, stress causes flushing and visible redness. Your skin's pH balance can shift, and its moisture retention capacity decreases. Stressed skin is often dehydrated, tight, and uncomfortable. Now, let's talk about specific skin conditions that stress can trigger or worsen. If you have acne, stress is likely one of your triggers. The combination of increased oil production, inflammation, and potentially stress-related habits like face touching creates perfect conditions for breakouts. Eczema often flares during stressful periods. The itching can intensify, and the affected areas can become more inflamed and painful. For many people with eczema, stress management is as important as topical treatments. Psoriasis, another inflammatory condition, commonly worsens with stress. Many people report that their psoriasis first appeared during a particularly stressful life period, or that flares coincide with stress. Rosacea can be triggered by stress-induced inflammation and blood vessel dilation. If you have rosacea, you might notice more frequent flushing and redness during stressful times. Hives can appear in response to acute stress in some individuals. These itchy, raised welts are a visible manifestation of your body's stress response. Even aging is accelerated by chronic stress. Stress breaks down collagen, the protein that keeps your skin firm. It generates free radicals that damage skin cells. It interferes with cellular repair processes. People who experience chronic, unmanaged stress often show signs of premature aging. The question becomes, how do you protect your skin from stress when stress is often unavoidable? The answer lies not in eliminating all stress, which is impossible, but in how you respond to and manage stress. First, recognize that your perception of stress matters. Two people can face the same situation and experience very different stress levels depending on how they perceive and interpret it. While you can't always control what happens to you, you can develop skills to manage your response. Breathing exercises are powerful and immediate stress reducers. When you're stressed, your breathing becomes shallow and rapid. Deliberately slowing and deepening your breath signals your nervous system to calm down. Try this. Breathe in slowly for 4 counts. Hold for 4 counts. Exhale for 6 counts. Repeat several times. Notice how your body softens. This simple practice, done regularly, can significantly reduce your stress levels. Regular physical activity is one of the most effective stress management tools. Exercise reduces cortisol levels, releases endorphins, your body's natural mood elevators, and provides a healthy outlet for stress energy. You don't need intense workouts. A daily walk, gentle yoga, swimming, or dancing all provide stress relief benefits. Sleep, as we discussed in a previous session, is crucial for stress management. When you're well rested, you're more resilient to stress. When you're sleep deprived, everything feels more overwhelming. Prioritize those 7 to 9 hours. Mindfulness and meditation practices help you develop a different relationship with stress. Instead of being overwhelmed by stressful thoughts and feelings, you learn to observe them with some distance and perspective. Even 5 minutes of daily meditation can make a difference. There are many apps and guided meditations available if you're new to this practice. Social connection provides powerful stress buffering. Spending time with people who support and care for you, sharing your concerns, feeling heard and understood. These experiences reduce stress hormones and activate your body's calming systems. Don't isolate yourself when stressed. Reach out. Find activities that bring you genuine joy and relaxation. Reading, listening to music, spending time in nature, creating art, playing with pets, whatever helps you feel calm and content. Make time for these things regularly, not just when you're already overwhelmed. Set boundaries around your time and energy. It's okay to say no. It's okay to protect your well-being. Chronic overcommitment is a major source of stress. Learn to recognize your limits and honor them. Limit exposure to unnecessary stressors when possible. If the news makes you anxious, limit how much you consume. If certain people consistently stress you out, limit contact if feasible. You can't avoid all stress, but you can eliminate some unnecessary sources. When you're stressed, your skincare routine can become part of your stress management practice. Instead of rushing through it, use these moments as a form of meditation and self-care. Feel the water on your skin. Notice the textures and scents of your products. Massage your face gently. These few minutes can be an oasis of calm in a stressful day. Your nighttime routine especially can signal to your body that the day's stresses are over and it's time to rest. This ritual helps transition your nervous system from activation to rest mode. Be realistic with your skincare during very stressful periods. If you can only manage the basics, cleanse, moisturize, sunscreen, that's okay. Don't add stress about your skincare routine to your other stresses. Do what you can and be gentle with yourself. If stress is triggering skin picking or other harmful behaviors, try to interrupt the pattern. Keep your hands busy with a stress ball or fidget toy. Apply a soothing product to your skin instead of picking. Acknowledge the